Hello and welcome to Bottomless Coffee. My name is Jerome Evans, and on this show we have conversations with people who are having a positive impact on the world around them. And we have those conversations over coffee or tea or hot water. Honestly, as long as the conversation is good, they can drink whatever they want. Today we're talking with Dr. Zeke McKinney. Dr. McKinney is the Program Director for HealthPartners' Occupational and Environmental Medicine Residency Program. That almost got me. And President of the Twin Cities Medical Society. Now, Zeke, are you okay if I call you Zeke?
Yes, of course. I'm not your doctor.
Well, I wonder if maybe you should be. Thank you so much for being here today. I did some research on you, and by research I mean I Googled you. And you seem to have a really fun job. You're on the news frequently, and the one that caught my eye had to do with the firefighters and the saunas. So can you tell us just a little bit about this job? And
well, where to begin? Well, so that whole big mouthful you said, occupational and environmental medicine, that's my specialty. So just like somebody's a family practice doc or a surgeon or an OBGYN, my specialty is called occupational and environmental medicine. Now you'd say, well, what the heck does all that mean?
That was my follow-up question.
I know.
Yes.
Nobody's ever heard of it. So if you say occupational, people fill in the blank of therapist, and I'm like, that's not what I do. So I'm an MD doctor, and our specialty is really about environmental hazards. If they're at work, we consider them occupational. Outside of work, we consider them environmental. It can be often the very same hazard. Somebody can lift a box at work or at home and hurt their back or their neck or whatever. But some people, like, let's say, work at chemical factories and maybe are exposed to things they wouldn't be exposed to at home. And so my job is really all about that. Now, in clinical occupational medicine, that really intersects with like workers' compensation, injured workers, getting people back to work, things like that. But, you know, we are still concerned with environmental hazards outside of the workplace, including, you know, things like climate change or pollution or a bunch of other stuff. And in fact, my actual focus in this field is on what we would call environmental toxicology. People who are exposed to dusts and chemicals and molds, often who have really weird illnesses that nobody can describe and understand. And they've seen 10 doctors who told them they were crazy, and then they come see me. Post-acute COVID syndrome or long COVID syndrome, which I know you guys interviewed on earlier, is another one of those things we don't really understand.
Okay. But then also, do you intersect with things that we do understand but maybe aren't necessarily doing enough about? So I really though, I chair the Public Health Advisory Committee for the City of Minneapolis.
Oh, all right.
And we're still talking about lead ingestion in children in particular. Is that something that comes up in your work?
Yeah, I mean, you know, whether or not specific people in my field are interested in that particular topic is up to them. But, you know, of course, from the toxicology focus, yeah, I very much am. In fact, I testified on lead for the House Preventative Services Committee here in Minnesota a month or two ago. There's been a lot of, actually, strangely, a lot of bills coming out about lead. One was to change, I think the last one I testified on, was to change what we define in law as an elevated blood lead level.
Okay.
And the reason that's relevant is it actually differs for adults and kids, and the number for kids actually got updated by the CDC in October.
Lower or higher?
Lower.
Okay.
It's always going down.
Good.
No, it is, yeah. So
you never know.
like scientifically, there's really no safe amount of lead for people, and especially for kiddos. So in law, just to set, you know, different policies, we have to define what that elevated level is. And so where it has been set essentially is like the adult level, though there was a footnote saying the Commissioner of Health has this lower level. And anyway, now they want to update it to the even lower level. And I think that's best to be most protective, you know, have the level that fits for kids, adults, everybody, whatever.
Huh. Now,
Go figure.
So you were testifying regarding not employer.
No.
Because we got the lead out of places of work a long time ago, it seems, but we haven't.
No.
Oh, okay.
No. I mean, we tried to.
Okay.
Well, okay. I mean, look back in 2019. You remember Water Gremlin, that company out in the East Metro? You maybe didn't hear about this. This was in the news.
Okay.
So basically, what they found was workers there were
fishing equipment to set.
Yeah, exactly. Lead sinkers and stuff. There you go. They were. I know you actually did read the news. No, so they went home and their kids were getting sick with lead poisoning because like they had dust on their boots and their whatever clothes and stuff like that. Federal Ammunition is a big company that makes bullets, and they're locally here too. So I mean, there's plenty of lead exposure to go around. I assure you.
Well, it sounds like you're very busy.
Yeah.
And yet, or maybe because of your busyness, let's say, you have intersected with a number of people that have actually been on this show Dr. Chomolo,
Yes.
Tito Wilson,
Yeah.
Kelly Robinson.
Yep.
Well, how did this, oh, Kate Murray, even.
Yeah.
Yeah, how did this happen? Like, what part of your work intersected with Black Nurses Rock and Wilson's Image and the like?
Oh my gosh, you just basically are asking me to tell like 3 different stories, but
I'll get comfortable.
Yeah, I know. Well, I'll start by saying that my field is a preventive specialty and in fact a public health specialty. So people who train in occupational environmental medicine have to get a master's of public health. Huh. So we are like already trained MPH doctors. With that being said, I mean, my dream job would be to work at MDH. They just can't pay me enough as like a community doctor.
Sure.
No, but with that being said, you know, I'm always interested in issues of public health, and of course, contemporarily, COVID's a huge one. Dr. Chomolo and I, now we actually knew each other from medical school. He was in the class above me, and so we've kind of been in contact back and forth since then. But I think COVID's given everybody a good opportunity to sort of start working on things that have a really large impact. So the story about Tito Wilson, this is like a really funny story, and it's got layers to it. So I ended up not being able to go to my barber anymore because they got so busy, like you just couldn't get in to see him, even though they booked out like 60 days. I said, look, I'm a really busy doctor. I'm not sure you guys got to like, you know, bend backwards for me, but like my schedule's tight.
Yeah.
I know I will come every 2 months, just save me a spot. And they wouldn't do it. And so even if I went on like day 60 to try to schedule an appointment, couldn't do it. So I was like, man, this is just too much trouble. Like you're making it too hard on me as a customer.
Yeah.
So I had to go find a new barber, and this is like right after COVID started. So this is like June of 2020. And so somebody recommended Tito Wilson's shop, Wilson's Image, on Broadway and Penn in North Minneapolis. That's where I grew up. So I said, okay, I'm down with that. And so I go over there, and I walk in the door, and I'm wearing a mask, and I'm like the only person in the whole spot, June of 2020, wearing a mask. Ooh. And so like I almost like turned around and got out of there, but I stopped myself and said, you know what? This is a public health opportunity. An opportunity for me to spread good information to the Black community where I grew up in.
Yeah.
So I went in there and went ahead and sat down, and I started talking to Tito and the other barbers, and I think at first they thought I was like some kind of narc or something, because they were like, what does this guy ask us all these questions for? But also I was a little bit worried, like at that time you could get fined and stuff if people weren't following regulations. And so I was kind of like actually worried about them. But anyway, so through going there periodically, every month or two and get my hair cut, we kept talking more and more and more about it. And eventually it came to the point, well actually, so during this time, I started being a researcher on one of the vaccine trials. Oh. And so of course I'm talking to them about that too.
Okay.
And then it finally gets to the point in January, and I walk in and I'm about to get my hair cut, and Tito's like, hey man, where do I get a vaccine? And I'm like, what? Because he was somebody who it seemed like he didn't want to.
Right.
So that was pretty interesting to me. And so we started talking about it more. He wanted to actually do more outreach about it and kind of inform people about the risks and benefits. We did like a Facebook Live sort of community town hall in the barbershop. You know, people who were for it, people who were against it, people were kind of in the middle. And it was a nice open discussion, whatever. Yeah. That followed up with then we were featured in this documentary that didn't end up coming out till September, but they actually filmed that town hall and interviewed Tito and I, called Trusted Messenger. It's on TPT. You can see it on their website. It's actually pretty cool. I think it won some awards. Then the Minnesota Department of Health tasked Tim and I to be in some commercials. Y'all might have seen those last year. They were playing like during the NBA Finals and the Olympics. I didn't know they were going to be that big. Apparently there's still a billboard of me somewhere like up 35W towards Duluth with some good vaccine information that seems like it hasn't lost relevance, thankfully. And so it was like more and more stuff kept happening.
I want to see this billboard.
I can show you a picture of it. I've actually never seen it in person, but I've got sent a couple pictures. So then finally in June of 2021, there was a news story that came out in the Washington Post that was like, the Biden administration, the University of Maryland School of Public Health want to start this Shots at the Shop initiative, try to get barbershops and salons to, you know, perpetuate vaccination in, you know, the community, which is great. And by the way, this isn't like a genius idea, and it wasn't me, and it wasn't even them. I mean, there's been plenty of research in, you know, the field of preventive medicine that have shown, you know, doing preventive services or health outreach, you know, engaging people with clinical services in the community, barbershop, salons, churches, community centers, whatever, you name it, works great. Everybody loves it. It works excellently. So this was a good idea. So Tito all of a sudden was like, we saw this, we're like, hey man, this is like what we've been talking about. Let's do it. You know, whatever, great, we're on it.
Yeah. And
we were a little bit early, but we figured out through the Minnesota Department of Health that essentially this was through Shea Moisture. Every Black person probably knows what Shea Moisture is.
We do.
Yeah, and they were giving out $1,000 grants, which I think would be like, you know, maybe a 1 or 2 day vaccine event for people to do it. Okay. But fortunately, the good old Minnesota Department of Health, I'll give props to them, were like, well, hey, you know, we got federal funding for COVID stuff. Like, do you guys want to do something bigger than that? I said, yes, yes, I do. And very particularly, my interest was in making something that was there recurrently.
Yeah.
And so we set it up every Friday and Saturday for 4 hours each day, and that's been going on since July 9th. At some point, we extended it to 5 hours. Right now, we're probably getting ready to cut back because not as many people are getting vaccines, but we are at least still funded to go through June 30th, which would be about a year, which is pretty cool. And in that time, I don't know, I think we've done probably like 1,300, which isn't a huge amount, but that zip code 55411 is one of the lowest vaccinated zip codes in the state. I mean, of larger zip codes. I think like if you look at census, it's like 26,000 people. So if we did 1,300, that's like 5%, which is not bad. So that's, been really a good experience. And the reason it was important was, I was volunteering at like before this big vaccine events, somebody would like rent out a gym at the YMCA or whatever. Sure. And you'd have like 100 people volunteering, 50, 100 people volunteering. You have like tables, not just for COVID, but for other types of screening stuff, people giving out things, blah, 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 blah. And maybe you vaccinate 50 or 100 people in that day. Now, I'm not saying that's bad. I'm just saying that's like a lot of resources for maybe not as much of a high return. And ultimately, it doesn't help address the issues for the people who really need it. So like, for example, a lot of barriers for people are, just thinking about it. So let's say I'm thinking about getting a COVID vaccine. I walk by and I see this vaccine thing at the Y and I'm like, okay, maybe I want to do that, but I don't know. I'm not sure if I'm ready today. Maybe I'll come tomorrow. There is no tomorrow. It's gone. It was a one-day thing. Okay, what about the people who don't have childcare, can't get a day off work, who are worried they're going to get fired from their job when they have side effects and can't go into work the next day? Yeah. There's like so many layers to this thing. And so our hope was by having this well-trusted community site, everybody knows the barbershop is a place you can, talk a little bit. Yeah. Be able to educate folks, have it right there available, black doctors, black nurses, the whole 9 yards. And I don't know, I think it was pretty successful.
I think it was very successful because I have a side hustle in addition to this one where I share information about where vaccine clinics are taking place. And the only barbershop that routinely comes up is Wilson's Image, and that's statewide that I'm seeing. So you don't, sell yourself short. I think you did some really fantastic work there, or at least you were the right person having the right conversations with the right people.
Well, and to be fair, it wasn't just me. And so that's where Kelly Robinson comes into play. So
isn't she amazing?
Oh my gosh, like I want to be Kelly Robinson. I'm trying to be her when I grow up. No. So when she had started her own company
Messianic Care.
Exactly, Messianic Care, to be able to provide vaccines to the community because there was a huge need for communities of color to have people who looked like them delivering vaccines. And so something that she felt like she could do, and also using her role as the president of the local chapter of Black Nurses Rock. And so as a function of that, she became our great partner in this, and they were the ones who did provide the vaccines there on site. And then the Stair Step Foundation was really integral, and also getting some boots on the ground, getting some resources. So this thing really organically grew even more than what we'd even intended. I mean, our initial thing was like, just have a couple nurses there, give out some shots, like whatever. Yeah. And it was like, no, we had this like mobile units and like all these people and surveys, and like it was like a whole 9 yards. I mean, it was crazy. Now, other shops were attempted to be engaged by MDH. Obviously, not everybody was into it, but even the people who were into it, space was a big problem. And so I think Tito's particularly fortunate that he has a larger, maybe larger than average space. Sure. Because a lot of places just really couldn't accommodate it otherwise. And maybe didn't even have like a parking lot to have a mobile unit or something.
And I suppose there could have been other concerns as well. You mentioned one barbershop not being able to schedule time ahead of time, and presumably, Tito was able to make that happen for you. So maybe he was more flexible than some other businesses in the area as well. Interesting intersections with the COVID-19 vaccine. How else has your work kind of brought you into that sphere?
I mean, there's a lot of it. So, of course, working on the vaccine trial, then people were asking me all the time to...
Yeah, tell me more about the vaccine trial.
Well, it's really funny. I mean, it's funny because it's for a vaccine you've never heard of.
Okay.
So it's made by a company called AstraZeneca, which is totally actually a well-known pharmaceutical company. But again, most people don't know a lot about pharmaceutical companies. And they're not based in the U.S. Okay. It's actually the most widely given vaccine in the world. Oh. I have my own suspicions as to why it's not been approved here, because the data is great. Okay. So it was kind of similar to the Johnson & Johnson vaccine. You didn't need to keep it in a crazy freezer. It was 2 doses rather than 1. But that issue of storage made it so it was like easy to take to places that didn't have a lot of resources. Rural South America, rural Africa, whatever. Sure. And so it's a great vaccine, and that was one reason why I really wanted to work on it, because they said from day one they were going to sell it at cost, and they did. Oh, and so it costs like, I don't know, 10 to probably 100 times less than like Pfizer or Moderna.
Oh, I was unaware of that.
Yeah. And so, I mean, just, theoretically, what happens the day AstraZeneca gets approved in the United States? Perhaps stock prices for some U.S. companies that make vaccines might go down. That's just supposition. I don't have proof of that.
Sure.
I'm suspicious somebody might win a Pulitzer Prize in a couple of years about that story, but
We'll
to
see.
be determined.
I hope they're interviewed here on Bottomless Coffee.
Yeah, exactly. That's your plug to get them. No, but it was actually a really good and interesting experience to work on that. Again, getting a chance to meet people, like, where they are, to talk to people. And of course, the people in the trial are people who are kind of into this stuff. But, I got to learn more about it.
You were holding trials. Is it like the classic thing with the placebo effect and what have you?
Yeah, so it's actually a randomized controlled trial. So randomization is designed so that, like, let's say, for whatever reason, you said, well, I'm going to put all the men in the group that get it and all the women in the group that don't get it, or whatever. There would obviously be huge biases. So you just randomly assign people, and, then all that stuff sort of fades away. Secondarily, the participants don't know whether they got the real thing or the fake thing. And similarly, the doctors or the researchers don't know that either. Because that way, let's say I was just in my heart of hearts wanted the vaccine to work, and probably I do have that bias.
Sure.
Well, I can't do anything about that if I don't know who really got it. You know what I mean?
Yeah.
Because then you might be more inclined to, like, oh, well, this side effect, I'm not going to say anything about that. And are these people who, everyone's biased.
We understand bias on this show,
Yeah.
I think.
And so that's like a real thing in research. So it really was one of those trials. And so all it involved was people getting a vaccine and then coming in and, like, if they got sick, we'd evaluate them, which was nice too for them. And that was actually a lot of what I was doing. I was seeing people who got COVID either with or without the vaccine. I guess we didn't know.
And this was the same type of research that was taking place for all of the vaccines that did get approved.
Correct. And it got really weird because it wasn't approved here, but like in that January of 2021 range, we still had people in the trial who then wanted to find out, like, hey, did I get the real vaccine or not? Because now I'm eligible for a different vaccine.
Sure.
So we had to start unblinding people, and then over the next 4 months, we unblinded everybody, and it was like that was a huge amount of work, but it was worthwhile because obviously it would have been unethical to not let somebody get a vaccine who it was not available to.
Yeah, and then there are these questions for, and since I got the Johnson & Johnson vaccine, and so it was like, well, can I get the Moderna booster, the Pfizer booster, what have you? And so I imagine if you don't know whether or not you received the AstraZeneca vaccine, and you probably can't find any studies in the United States about getting a Pfizer booster or Moderna booster.
Not at that time. I mean, even no one had boosters back then.
That's
so
true,
it was
that's
like,
true, that's true.
That was all like way in the future. But no, it was actually, the data has shown that actually mixing and matching works really good.
Oh, good.
Yeah, so if you got a booster from Pfizer or Moderna, you're probably doing all right.
That's very reassuring. Thank you very much. I was, I just went to Orlando with with some other people from work, a different job, and one of my managers went in and got a physical and was not going to get that additional booster. The doctor was like, you just had one fairly recently, you don't need it. And then she said, well, I am going to Florida. And the doctor was like, well, they run a little bit higher there, so we're going to go ahead and give you that second one.
Yes, I would like to refer to Florida in terms of COVID as the block is hot.
Okay. It's lit.
Yeah, and not the way you want it to be.
Okay, so, but those kind of recommendations, I think, and I know that may or may not be your area, I'm not sure. Like, why is it that when she goes to the doctor and is going to Florida, the doctor is like, oh, you should get that second booster. Whereas if I go to the doctor and I'm saying I'm going to Florida, I wonder if I would get the same advice.
Oh man, that's a lot to parse out there. It depends on who your doctor is.
Yeah.
But there is bias for, different people, even based on how they look, about what type of advice they may or may not get. Yeah. In the case of your friend, though, I would guess it's really an issue of risk profiles. Like the doctor was like, well, I don't know, maybe it's okay. But then they were like, oh, you're going to Florida? You just told me like you're greatly increasing your risk. So maybe I will advise that.
Well, let's bring that even to like occupational concerns, right?
Hooray.
So like some employers would mandate vaccines, let's say. Do you think some might also mandate boosters?
Yeah, I think the ones who would mandate vaccines would mandate boosters. The whole premise usually is like they're mandating you be up to date, whatever that means at any given time.
Yeah.
And so, yeah, that's happening. That has happened. I've seen places do it.
Is that the kind, do employers come to you for advice?
Yes.
Okay.
I actually work as a medical director for various employers, including specifically about COVID.
Well, do you advise them to mandate that their employees be up to date?
Ooh, it depends on the employee. Okay, so here's the thing. At the end of the day, a doctor like me, a work doctor, my job is to give them advice. They have to decide to do whatever they want. When it came to COVID, what I told everybody was like, look, all you got to do is ask yourself, how comfortable are you being on the front page of the Star Tribune about acts regarding COVID? And that should help drive your decision making.
Okay.
But no, with that being said, and I also tell everybody, like, I'm super draconian when it comes to COVID. Like,
Okay.
I don't go nowhere. I haven't been on a plane. I haven't been to a bar. I haven't been to a restaurant. I don't do nothing. Don't do nothing. But I still also have a kid who's unvaccinated, you know what I mean? So, like, that's a real thing to me. And by the way, I think I'm a high-risk vector for people I hang out with. You know, I see people in clinic who all the time aren't vaccinated. For a while, I was seeing people in the trial who had COVID for sure. In addition, you know, I'm going to the barber shop and, you know, all bets are off there as far as who wears a mask and who's vaccinated and whatever. So, you know, in general, I think I'm a higher risk transmission person. But that being said, I'm pretty careful also.
Huh. This is really interesting. And I think we're going to dive into this a little bit more because I'm interested in your take on healthy communities, like your
Wonderful.
barber shop and like places of employment. But let's get to it after this coffee break. Sound good? We are here with Dr. Zeke McKinney, Program Director for HealthPartners Occupational and Environmental Medicine Residency Program. That does not get easier to say
It really doesn't.
with time. Now, you championed the Shots in the Shop program to great effect, and I'm not going to let you be too humble about it, but I am really interested in your approach to healthier communities. We talked about the employer side. We talked a bit about families. Like, what's your mindset there?
Yeah, it's really multifactorial. You know, I mean, I think taking just a sort of broad public health approach, people talk about social determinants of health. And it turns out, just when you look at health outcomes, the social determinants, that is all the things that happen outside of the exam room, according to literature, make up 50 to 90% of health outcomes.
Oh.
So basically, whatever I do in clinic kind of doesn't matter.
Yeah.
It really matters what's going on outside of there. And of course, those would include things like what's somebody's education, what's their housing status, what's their employment, you know, have they been incarcerated? Do they have access to transportation, to food? You know, like the whole 9 yards. What's their built environment like? You know, like, so for example, doctors or, you know, your insurance company would say like, well, gee, why don't you go jogging? Why don't you go exercise? It's like, yeah, because I live in an area where there's major amounts of crime and I might get shot if I run down the street or whatever, you know what I mean?
Sure,
That
or,
doesn't,
you know, major amounts of other things that I might get shot if I run down the street.
Exactly, whatever it is. And so, you know, or like, hey, I work 2 jobs and barely living paycheck to paycheck. Where am I going to find time to like go to the gym? And by the way, I can't even afford a gym membership. I mean, so it's like layers upon layers. And I really think of healthy communities as ways in which we can support each other. That is, the community can support each other, you know. So I wish everything, whether it's the gym, the barber, the doctor, the grocery store, had sliding scale fees, but you know, that's not necessarily business sustainable. I get that. But also, you know, insurance companies are so interested in the bottom line of how do we save money, but it's like they don't approach it really with the long view of how do we prevent people from getting sick in the first place.
Yeah.
And so if I had to give anybody advice, I'd say, yeah, you know, really invest in the community, invest in making sure that people have equitable access to resources.
Now that's, okay. Advice, I'm interested, particularly at the intersection of COVID-19, but then maybe also at any other intersection that you're interested in. What advice are you giving to employers when it comes to best practices regarding COVID-19, like as people are coming back to work and what have you?
Yeah, I mean, honestly, if I could convince everybody to keep wearing masks, I would. But at this point, I don't think people are necessarily about that. I have mixed feelings on vaccine mandates. I mean, on the one hand, obviously from a public health perspective, they're super great. Vaccines and treatment of infectious disease is basically what extended human life expectancy by like several decades.
Yeah.
Unfortunately, you know, it comes at a cost. You know, if you put in a vaccine mandate, you're going to lose a lot of your workforce just because there are people who are like, hey, I just don't want anybody to tell me what to do, and therefore I'm not going to do that, and you can't dictate what I'm going to put in my body, and they're right for that, you know. The first principle of medical ethics is patient autonomy, meaning you get to choose what's right for you. So at the end of the day, yeah, I mean, somebody would say, well, it's not fair that my job's making me get this vaccine. And I'd say, well, inversely, you don't have to work there.
Right.
But that's not a realistic approach because, you know, not everybody has access to an infinite number of jobs all the time. And so it's really a balance of all these different things. And from a public health perspective, I mean, my personal opinion is, well, look, it costs something for me to live in society with other people. Sure, if I want to go live out in the middle of nowhere and, farm my own food and, live off the land, I guess it doesn't really matter what I do. I don't need a vaccine. That'd be fine. But living here in the city, I can't just go and be like, oh, well, that's Jerome Evans's Lexus. It looks nice. I'm just going to take it because I think it looks good, and so be it.
Sure.
Because we live in a society. Part of it is adhering to laws and, policies that we have all, the social contract. And so I think that extends to COVID, but I don't think people think of it that way. And so going to the employer perspective, it's just a tough balance, because on the one hand, employers don't want to turn away people who are scared of COVID and knowing employees aren't vaccinated. But inversely, they don't want to lose good employees. And right now, it's very much an employee's market more than an employer's market. So it's a super hard balance. I don't know that I have perfect advice. I guess it just really depends on this. What's your goal? Is your goal to have no COVID? I can tell you how to do that. Is your goal to have the most business? I can tell you how to do that too. You know what I mean? But those are all not necessarily congruous goals with each other.
Okay, well, let's say there were COVID outbreaks that were pretty detrimental to the general economy, the state economy. Was it a pork plant, I believe?
Oh, yeah.
Pork or chicken, way back in the beginning. I keep taking it all the way back.
No, but that's
COVID
good.
surge one. If they came to you and they said, hey, in order for everyone to keep enjoying chicken or pork chops or what have you, we got to get people back to work. Would you say, well, the best way to make sure we don't interrupt that supply chain is to mandate vaccines? Or would you give some different advice? Or would you say, actually, you should just go ahead and invest however much money and spread people out, or all of the above?
All of the above. So you, without even knowing it, are speaking through a very important public health sort of philosophy.
I did it.
Called the hierarchy of controls. So this is what we think about in, in injury prevention or in occupational medicine and stuff, which essentially is how do you control hazards? And it's basically an upside down pyramid. And the biggest part of the pyramid on top, which is most effective, but also the most expensive, is elimination. Let's eliminate the hazard. Well, oops, I can't get rid of COVID. Okay, next step.
Okay.
Number 2 would be substitution. Can I substitute the hazard with something else? Like if I'm making a process with a chemical that's dangerous, can I use a chemical that's less dangerous? Again, in the case of COVID, cannot substitute that out. All right, keep moving down. And so then the third would be engineering controls. So let me put it to you like this. Let's say I put in the best ventilation in the world in this room, where the air in this room, this entire room, was turned over 100 times an hour. It wouldn't matter if you and I had COVID and we're breathing at each other. It would just be gone. Nowhere has that good of ventilation. Most environments are like 3 to 6 per hour.
Yeah.
But my point being, you could engineer it out and nobody would have to do anything. It's super ultra expensive, on the order of almost impossible. Okay, we'll move down a layer. The next would be administrative controls. Spread people out. Maybe have okay, well, can we have people work in different shifts so there's not as many people in the building at the same time? Stuff like that. Again, you can do it. It's also expensive. The cheapest and least effective is personal protective equipment. Masks, vaccines, whatever. Because it depends on people doing stuff. So even in jobs before COVID, where people had to wear respirators, I'm painting with hazardous chemicals, I'm grinding countertops for kitchens, whatever.
Yeah.
People don't wear their masks all the time.
Yeah.
People, it's uncomfortable, they don't feel like it, they're just I don't really care what people tell me to do. Pick your favorite thing. The vaccines, on the other hand, are nice because once people get it, you're kind of done. They can't undo, you can't take it out, you know what I mean?
Yeah.
And you don't have to look and see, oh, is somebody wearing that mask? So, vaccines are a nice one for that reason, for your plant.
Sure.
And they're super cheap and widely available. So, again, it just depends on what people's interest is. If their interest is, well, I want to have zero COVID, but I also don't want anyone to be vaccinated, well, that's a different scenario. And so it's really all about, a balance of risk and benefit for everybody. And that's why I said, what are you comfortable being on the front page of the Star Tribune about? Are you comfortable being on the Star Tribune with an outbreak and your, meat processing plant closes?
Yeah.
Or are you comfortable being on the front page of the Star Tribune because people are rioting that you had a mask mandate? It's all 6 of one, half dozen the other.
You are absolutely right that I was not familiar with that phrase,
hierarchy of controls.
Yes, but the different levels of the pyramid, those did strike a chord. I remember I had my husband's brother over during one of the surges, and I said I had him over. I didn't have him over. He came over. And I was like, he can come over, but we're going to open up all of the windows, the patio door, what have you, and we're all going to have our coats and blankets because we need the ventilation. I'm sure we didn't get to that 100 times over.
Nobody
example.
does that. That was like a magical number.
Yeah. But when employers are thinking about bringing people back to work, there are some steps in there that they should consider, because not every employer is going to reach out to you and become informed on this hierarchy, you know?
Well, so here's another issue. So I always tell people, or even if an employee asks me like, well, gee, I'm not sure my job's, doing the right thing. And I'd say, what physician or public health professional did they talk to about their policies? And for most people, the answer is nobody.
Yeah.
And that's a mistake, because then when you do come up on the front page of the Star Tribune, or when something really bad does happen, and let's say the health department or I don't know, some federal judge or whoever is knocking on your door, and they say, well, who helped you with this policy? And you say, oh, I don't know, we just did it ourselves. That's probably not a good look, bro.
Agreed. I would be very concerned.
But I mean, honestly, a lot of employers did that. Like a lot of employers said, well, look, the CDC guidance is out there. I can read that, so I'm just going to do that. And it's like, I guess so.
Now, is that part of the advice that you give to employees when they
Yes.
do reach out and they're like, I don't know what my employer is doing. How do I make sure they're taking all the right steps?
Yeah, I mean, to some degree, employees very much are on the wrong side of the power dynamic in an employment situation, other than the fact that most employment is voluntary, so you can just get out of there if you got to. The good news is, in the current age, I don't think anyone's going to stop you from wearing a mask if you really wanted to. And so that's good. I mean, trust me, before COVID, if I recommended an employee wear, like, let's say a half-face respirator, looks full on like Darth Vader style, and it, like, I'm not talking about for COVID, like I deal with people who have like, chemical sensitivity and stuff like that. They're like, I can't go to work like that. They're not going to let me come in here. I'm going to be scaring, kids out of school or people at the airport or whatever it is. And that's real. And so it's like, that degree of control only exists so much. But that being said, I think, it also depends on what type of employer you have. Some jobs are cool and would be interested in an employee who said, hey, by the way, I know this community public health doc who, is happy to talk to you about COVID. And I would do it. And I would do it. But, some jobs are like, I don't really care. I mean, so going back to my sort of primary clinical focus, occupational medicine, one of the biggest hurdles we have is, it's in everybody's best interest for an employee to get back to work when they're hurt. Now, people historically have this myth of like, oh, you're the company doctor, you don't care about me, you're just trying to make me go back to work. No, it's not like that. Because here's the thing, at the end of the day, genuinely, people don't want to see me. They'd rather just go about their business and keep working and make their paycheck and not be bothered. Great. Well, that's what your job wants too. So let's just all do that and get there. And it turns out if you are on workers' compensation and you're not like back at the job, you're getting paid through workers' comp, and it's not your normal wage. It's actually 2/3 of your wage, but like tax-free, so it's kind of the same, but not really. And if somebody forgets to send that check, then it's definitely not the same. And then, by the way, if you work overtime all the time, it ain't covering that. And so if I can get you back into work in some restricted fashion, where you're not making your injury worse, then that's good for you and it's good for them. And you keep your normal routine and you're used to seeing your buddies at work and all whatever. Okay. So the whole point of telling that story is a lot of employers are like, we don't have light duty. If you're not 100%, you're just not at work.
Oh.
And that costs everybody money and time and problems.
Yeah.
And so the same kind of physics applies to COVID. It's like, well, if you want to live on some island where you don't care about employee health and safety, then so be it. But it's going to cost you more money and energy in the end. And that's been proven for the last 100 years. I mean, that's why workers' compensation exists in the first place. If employees got hurt and died, it was very expensive for our company, and so much expensive they might get sued and go out of business. Well, workers' compensation generally stops that from happening. And the point of it is you're supposed to make a worker whole again. And the good news is now you don't have to retrain a whole new person.
Are these the types of conversations you were having with Tito in the barber's chair?
Not as much about this. I mean, I don't think he's thinking about, work comp insurance, but this is the kind of conversations I have with employers and sometimes with employees.
I could just see why he was like, yeah, okay, we do need to do something about this in the community. It makes so much sense when you put it to us in like just plain English, I
try to keep it pretty simple. So one of my mentors in medical school said like one of the most smart things I've ever heard. He said, look, when you go through medical school, you'll learn a whole new language. It'll become second nature to you, and you'll want to just talk to everybody like that, your friends, your family, your patients. Sure. And they will have no idea what you're talking about. And so you have to always just try to talk to people like normal human beings. And at the end of the day, I feel like I am a normal human being. I'm just a doctor at work.
Yeah.
You watch me walk down the street, I'm just a normal dude, like whatever. I'm just a regular guy.
Okay, you mentioned this a little bit in our coffee break because we were going to talk COVID-19, but you were also interested in talking about advice you give to employers that's not related to COVID-19.
Oh, well, I think I already just gave you some of that.
Okay. So long as the best way to take care of your employers, or employees rather, take care of your employers maybe, is to follow that hierarchy.
I mean, that to some degree, but
Like
I mean,
eliminate, substitute. In my mind, I'm like ventilate.
yeah, no, you're doing actually. I'm surprised you remember that much. Administrative.
Okay, and then what was the last one? Oh, like PPE and the like. Was the last?
Actually, we skipped one. Sorry.
Dang it.
Yeah, you're confusing me. No, elimination, substitution, engineering controls, administrative, and then personal protective equipment. Awesome. In that order, and it goes from most effective to least effective, and most expensive to least expensive.
Huh. Well, okay. Thank you very much. Why don't we take a quick break and process that, and then be right back.
Thank you.
We are back with Dr. Zeke McKinney. I just want to make sure I thank you for all of the work that you've done in ensuring that we have healthier communities. And I want to give you a little time to talk about something you might want to talk about. If there is like a final message or just something, final message sounds dark, something you want to make sure our audience takes home, what would that message be?
Yeah, first of all, thank you for having me on the show. And yes, I'm not going to give anybody a final message for their final destination. No, I'm just kidding. You know, what I'm passionate about is actually my field, occupational and environmental medicine. It's a specialty in medicine that nobody knows exists.
Yeah.
And yet has been proven, certainly during COVID, to be quite critical and really important. I mean, think about it. We have doctors that take care of kids, pediatricians. Well, shouldn't we have doctors that take care of workers or people who are trying to do stuff? Because here's the thing. I want to be clear. It's not just about work. It's really about function. How do I get people not only back to work, but back to playing golf, playing with their kids, whatever it is they want to do, you know what I mean?
Yeah.
And I think it's a really important specialty, but, you know, really under-recognized. One, because we have this big mouthful name that nobody knows of. Two, because people actually have heard of occupational therapy, even though they don't know what they do either. But we ain't them, because they ain't doctors, but I can't do their job either. So, you know, it's a real thing. But, you know, the bigger point is we're just a really small field, and actually funding for our specialty is a big problem. Now, people say, well, wait a second, aren't doctors rich? You know, do they really need more money? And it's not really how it works. It actually costs a lot to train doctors. There's a physician shortage nationally, but it's probably even more pronounced in my field. So it turns out every medical specialty increases the number of doctors that they graduate pretty much every year, and the number of doctors that graduate out of residency programs increases every year.
Okay.
In my field, that's basically been flat for 50 years in both dimensions.
50 years.
Yeah.
Okay.
And it's because of funding. So funding for doctors comes through the Center for Medicaid and Medicare Services, which is good, I guess, mostly. But the problem is it's based around like clinical training. And for most specialties in medicine, that's fine because you're in clinic or in the hospital all the time.
Sure.
We do plenty of clinical work, but a lot of our work is actually public health based, including getting a master's of public health, you know, doing rotations with corporate, you know, entities, you know, rotating with Minnesota OSHA or federal OSHA.
And public health funding is never where it's supposed to be.
I know. Working with Ramsey County Public Health. And so unfortunately, a lot of that time is unfunded. And so institutions don't like having occupational medicine programs because they cost a lot of money. There's only like 24 in the whole United States. In Minnesota, the one of which I am the program director is the only one.
Just want to make sure, there are still 50 states, right?
There are.
And 24
yes.
people in your position?
24 programs that graduate doctors who can be occupational medicine doctors. Iowa had a program. It just closed last year.
During the pandemic?
Yeah, politics, money, whatever.
Oh, okay.
And so there's only two in the Midwest, here and the University of Illinois Chicago.
And they are graduating plenty of people?
3, maybe? We're like 2, they're like 3. There's like 80 people a year that graduate who can become doctors like me.
So does that, and I know this was the final segment, so I wasn't even going to dig in too much, but does that make you concerned about all of the environmental hazards, like emerging and otherwise, that people just aren't catching and don't have someone to talk to?
Yes.
About? Yeah.
100% yes.
Okay.
I mean, so the good news for me is that like right now, demand is way greater than supply. I can move pretty much anywhere in the United States and get a job tomorrow because people want doctors like me. That's great, or at least the people who know about us. The problem is the people who know about us like aren't that many. It's like, you know, maybe employers, work comp insurers, maybe other insurers, work comp attorneys, maybe other attorneys. You know, not that many people, and not necessarily people with money. And certainly those people don't know anything about how medical training is funded, so they don't care. Or whatever. Most doctors don't even know how medical training is funded. The only reason I know is because it's germane to what we're doing. And believe it or not, pediatricians actually had the same problem. And then in the late 90s, like 99, they got the Health Resources Services Agency, HRSA, to basically fund $150 million a year through Congress to train kids doctors. And it actually worked. Now they actually graduate a lot every year.
Huh. I feel as though there should be interest in lobbying Congress for more people in your position, or graduating more doctors to do what you do, since, you know, where capitalism is still real. You'd think you'd want like healthy, productive workers. It seems like a way to keep your employees healthy and productive.
It turns out if your employees are healthy and happy, your stock prices go up. That's been proven.
There you go.
But with that being said, the bigger problem is not even the funding thing, that nobody knows we exist.
You need marketing.
Yeah, so we do have a marketing problem. And there's like 10 reasons for that, I think, too. So this is like a really deep problem, as I think it's clear, but it's something that I'm passionate about, because the thing that scares me to death, and this is selfish, but you know, when I retire in whatever, 30 or 40 years, my specialty might not exist because more people are retiring than are graduating right now. And so this is really scary to me. And the fact that like, well, gee, if I wanted every employer to even consult with a doctor like me, not necessarily hire them full time, there ain't enough of us around. And I'm not knocking other doctors, it's just this isn't their training.
Yeah.
I'm not trained to be a surgeon, you know, and I'm not going to try to do that.
Yeah.
Well, similarly, I wouldn't ask other doctors to, you know, tell employers about workplace hazards, workers' compensation, what happens with OSHA lost time injuries, you know, all that kind of stuff.
Oh, this is so fascinating.
I know weird stuff.
Well, I'm thinking back to so I think I mentioned this on air, I'm not sure. I chaired the Public Health Advisory Committee for the city of Minneapolis. We had Dr. Tomolo come on, and he gave his presentation on Medicaid and its impact or lack thereof, or the gap with Black people in particular. And one disparity that was really called out was asthma. A lot of asthma. And I'm like, oh, who would I go to investigate the cause of this disparity with regard to asthma? And I'm like, you would be the guy, but you're so busy.
Well, therein lies the problem, and why I want to train more people. Fun fact, related to my field,
Yeah.
like 5 to 20% of asthma is occupational asthma.
Oh, really?
Yeah, and people don't know that.
I did not know that, but I think you just saved the committee a little bit of work. So.
Well, unfortunately, a lot of it's under-recognized, and that's the really sad news. And so then people get really sick and can't keep working, and you know, it's like really a vicious cycle of things that happen when workplaces aren't safe.
Well, just because I'm nosy, is it frequently the same thing that's causing the asthma, or is it a variety of factors?
You mean for an individual person, or like for the community?
For, let's say both.
Yeah, so for an individual person, often it can be like they have one known hazard at work and that's causing it. Some workers are exposed to a lot of different things, and because their job can't accommodate them to separate different hazards, then I can't ever figure out which one it is, but I know it's one of them. Out in the world, there's actually tons of different things that can cause occupational asthma, aside from, by the way, other lung diseases. So classical, actually, occupational diseases are lung diseases. You know, people who are exposed to silica, asbestos, you know, things like that. That's my gig, man.
Oh, okay.
Though really, in our really like world of clinical medicine, we mostly deal with musculoskeletal stuff, you know. People who hurt their necks, their back, their shoulders, and their knees. We're kind of like sports medicine docs, not as smart as them. Maybe a little step up from family medicine, but we do that all the time.
Well, thank you for indulging my curiosity. I went a little bit deeper than I know we had planned to go, but it's clear you are very passionate about it. And we are very grateful that this award-winning for that documentary. You get to be award-winning?
I think it was well, it wasn't my documentary. I just happened to be in it a little bit, but I believe it was award-winning.
Present for a possibly award-winning documentary. Incredible guest, incredible doctor.
Thanks.
Thank you very much for your work. Incredible community member.
Well, I think you're doing a good job here too.
Well, we'll just keep those accolades coming.
Yes, sir.
Thank you very much.
We can boost each other up. That's what we got to do as Black people.
Cheers to
that.
that.
I like that.
Thanks, everybody. I'll see you next time.